I am Sarah Bramblett. I am a patient. Oh my gosh, and Cheyenne already did the flashback, which is actually part of my talk, so we'll skip over that. But I am coming to you today as a patient, not as you have known me from past presentations. Not that I'm not still board chair of the Lipedema Advocacy Group, I'm just not making any promises of work that that organization is doing. So with that, okay, so I do have disclosures. I'm a consultant for Boehringer Ingelheim, and one that has happened since I submitted these slides is I am on the advisory board for Alta Medical. Okay, so how did we get here? Again, Cheyenne has already kind of gone over this, but just, and I put Fat Disorders Research Society because I believe that's what it was back in the day, and they have changed the name. And I attended the Tucson conference in 2013. And then of course we have the Lipedema Foundation, founded by Felicity, the research roadmap that we just did, and then please, all the patients on social media, give yourselves a round of applause because you have got us here. You are what have gotten 400 people to this conference. I have been diagnosed, sorry, it'll be 20 years this June that I was diagnosed with lipedema. And for everyone who's newly diagnosed who thinks there's not enough known about this disease, imagine my excitement when I look at those slides of all the research that's been being done in the past 5 years. And I think one interesting tidbit that no one has mentioned yet is when Felicity first founded the Lipedema Foundation, you know what her first research project was? To research what research existed about lipedema. So, and I just want to say, because as Cheyenne said, this movement is being driven by patients at this point. This is a all-volunteer patient board, the FDRS, and the patients on the various Instagram and Facebook and TikTok even now, which I'm not on that, they are building the awareness. And I think we are, as much as there's still work to be done, there is a lot more awareness happening. Again, we have this many people here. So why am I here? So I was at that FDRS conference in DC speaking about the Lymphedema Treatment Act. And when it came time for the question and answer, there was a question about where's the Lipedema Treatment Act? And I was just like, well, I mean, figure out what your ask is and let's get to Congress. And I actually found out that Felicity kind of like planted that question. The good news is, as I mentioned in my talk last year, the needs of this community, all of the community, Dercums and the FML and Madelungs, most likely don't need another act of Congress. It's going to take us 14 years to get changes made. So we can do other things. But with that said, I have been 10 years working to get the lymphedema, just personally, to get the Lymphedema Treatment Act passed. And so I know a lot about working through the legislative process, but also through the administrative process and regulatory process, because in this past year, we had to get that bill implemented into the coverage that began January 1st. And there is still work to be done because that coverage isn't perfect and because we're working with healthcare and the government. So part of my goals of my advocacy from the past 10 years, though, as I mentioned, I was diagnosed with lipedema 20 years ago. It was 24 years ago that I actually first tried to get help and was told that my lymphedema and everything was just my weight, just lose weight, have bariatric surgery, which I did. I've been down, I've been back up. But my goal has been to bridge these two communities because it's the doctors who are treating patients for obesity or excess weight who don't know what they're seeing, and so they need to know what they're seeing. And a dream of mine happened last October where the Obesity Society and the Lipedema Foundation co-hosted a panel at Obesity Week about lipedema, and I was the patient presenter. Thank you. But you've heard the name, but I'm just going to first name basis. Shelley was on that panel, as was the other Sarah. So afterwards, Shelley was like, when are we going to DC for lipedema? And I was like, what are we going to go there for? And again, I know what we need, but we need to have an organization. You can't just roll up into DC and get a meeting. I've done it. But usually they like to know what your ask is. Ask, A-S-K. So actually I met with Shelley and her colleague Allison about what their kind of thoughts are on bridging this research that's being done into policy. It doesn't do good to have all this research, and it was just mentioned by the previous presenter. Insurance companies and payers want to know the science behind that. Our stories are very powerful in getting policies changed, but it has to be combined with the research being done. So these were the three things: the increase in funding for research, which we're hoping to, and for anyone who doesn't know, Felicity is on the newly formed Commission for Lymphatic Diseases by the NIH, and that is going to help tremendously. Okay, this is the next one. We need an ICD-10 code. We know that the World Health Organization has an ICD-11 code. US government is a little slow. The CDC doesn't have a timeline for implementing ICD-11, but there is a process to get new codes under ICD-10. And Dr. Wright and Dr. Herbst and AVLS, which is the Venus organization, has been in that conversation. So hopefully that can happen soon. I know with the Lymphedema Treatment Act, lipedema patients felt excluded because it's not covered for just the diagnosis of lipedema. But the fact is, there's not a simple diagnosis of lipedema. So we can't include your diagnosis if there's not a diagnosis code. There's codes that are being used, and your electronic medical records might have a code that says lipedema next to it, but if you look up that code, it's not a lipedema code. It's edema other, lymphedema other, or something else. So with that, also improved access to care for patients. So what does access to care mean? Anyone who's using the app, I actually have a poll where I'm asking questions about this. So if you want to take that. But some of the things I do have is insurance coverage. That's a big issue. Insurance coverage for surgeries, for medications, for MLD, for compression pumps, for compression garments is still an issue for everyone. But I have health insurance. I have Medicare, but it's insurance, so certain things are covered. I still can't get some care because I'm too big for equipment. Anyone else have that? Too big for the equipment. Can't get an MRI that I need. Couldn't get a cardiac procedure a couple years ago until I lost weight. So we have that access to care issue that we need to do. And so again, these are some of the things: accommodating equipment in facilities, treatment options for all. I stand here as a patient who was probably advanced stage by the age of 18. I need care as much as everyone else does, and it's very limited for patients like me. And I'm just going to say this, it might ruffle some feathers, but what is up with BMI limits for lipedema surgery when you know we have difficulty losing weight? If I could get my BMI to a 40 or a 35, I'd be golden. I would personally, because it's 70 right now. And if we're having surgeries in hospitals, why is it an issue? So that's just my thing. So, okay. So how do we get there? So these are the different ways to advocate. This could be a whole weekend topic, and that's what I kind of wanted to do, is have like a brainstorming session. So on the state level, there's legislative and regulatory. So if you have Medicaid, that's different in every state. You have your insurance commission that guidelines over private insurance or ACA plans. You have licensing boards. So if you're a facility that is being told, oh, you can't do certain procedures over a patient with a BMI, you know metabolically we're healthier than the average patient. So fight back against that BMI that, that just, I don't forget the word, but, just arbitrary BMI rule, and look at our overall health and clear us for procedures. Providers can do that with their state regulatory or their licensing board. And hospital regulations. If a hospital can't accommodate you, again, let's go to the state, go to the regulatory and ask them, why isn't healthcare more accessible for us? This morning, I went to the airport. There were probably 20 or 30 wheelchairs outside with people willing to push me to the gate. I pull up to a hospital, I have to get inside before anyone can get a wheelchair. Why is healthcare so inaccessible? I step onto the plane, they offer me a seatbelt extender as soon as they see me. I go into the hospital, I have to ask, do you have a gown that fits my arms? Oh no, every year I get a mammogram, I ask, and every year they don't have one. I've even emailed and said, why don't you have bigger robes for mammogram patients? There are people not getting their mammograms because they're embarrassed. Why? It's so simple, but we need to speak up. So this is beyond just this community. Our needs overlap with other communities that we can advocate with. On the federal level, not just Congress. Some things do take an act of Congress. Let's hope some of our things don't, because that takes a long time. But we have HHS, which is the Health and Human Services. They are over CMS, NIH, which is the National Institutes of Health, the CDC, which is the Centers for Disease Control, and this is the other one, the Access Board. They're the ones that make regulations for people with disabilities for several different things, but healthcare is one of them. And I know lipedema is not obesity, but if you go to their guidelines for healthcare and you search for obesity, the only thing it mentions is people with disabilities have a higher risk of developing obesity. There are no guidelines right now in healthcare for weight capacities or certain widths or certain circumference for the machines. Why not? We're told we're 40% of the population, so why isn't, again, healthcare more accessible for us? But how do we get there? So this is kind of my favorite part. So get in the car, everyone, but who's driving? We need some organization. So we need to know who's going to coordinate and lead these advocacy efforts. I don't have the answer. Again, I'm wanting to propose this question because now I got the Lymphedema Treatment Act passed. I have a little bit more time, not a lot. I'm trying to enjoy life, but a little bit more time. And then the front patcher, that person to kind of help connect. There's actually a whole area of science called implementation science about how you implement research into policy and into actual care. So we need to look into how to do this. And then, your backseat drivers. But what other organizations out there who are doing work could we collaborate with? So I put some here, the obesity communities, rare disease communities, especially for Dercum and the other disorders. PTOT, so physical therapy, occupational therapist, endocrine societies, lymphatics, and the disability communities. Not everyone with lipedema has a disability, but I think for many of us, it's a debilitating condition. And then my favorite one is, who's got the gas money? How are we going to fund this? And again, I don't have the answers. I want to start the conversations, and maybe this is a broad audience. Maybe someone in the audience will want to connect with me afterwards, and we can make some plans and strategize more. But I will say, so GLP-1s, who's interested in those? Who would like to have better coverage for those? There is currently a bill in Congress that I've actually been advocating for 10 years also, that Medicare doesn't currently cover any medications for, they say weight loss. We would argue it's obesity. And again, I know it's not obesity for everyone. Just let's take the diagnosis, take your overweight, obesity, and get what we need. But we can't get it yet because the bill's not passed. And right now, most of the insurance coverage as of 2024 is being even more restricted to people only with diabetes. But there is a bill. If you scan this, you can send information to your members of Congress. Also want to mention that recently, I don't have any conflict of interest with this, so I'm going to say Wegovy was FDA approved for cardiac issues also, so hopefully there'll be more coverage for that. And just in this past week, Zepbound has been shown to improve sleep apnea, so hopefully there'll be some FDA approval for treatment of that. So as we are learning more about what these medications can do for people, and the research is coming through, the FDA is approving them for other indications, and that should help get coverage for them. The next one is traffic. Okay, so how many, I know we have people out here who are wheelchair users. I don't know if you fly in a wheelchair, but that is a huge issue with the people screwing up your wheelchair while they're transporting it. I want to bring up the point, there's now a proposed rule to put more rules into the FAA for the airline carriers and how they treat wheelchairs and how they have to make up for it if they do damage it. But this first came out, sometimes the first step in advocacy is collecting data. So Senator Duckworth a few years ago actually passed a bill to actually collect the data of how many wheelchairs were being damaged every day or every year. Once they got that information, then they could move on. So sometimes advocacy is a step-by-step process. But they also kind of mention anyone with disabilities. So I've been on a public comment kind of kick this year. So I'm planning on submitting a public comment of this is a great step, and I hope it proceeds to how we treat every passenger with a disability better, and we should look to that. Okay, this was a recent one, and this was about the facilities being able to have diagnostic equipment accessible for people. I submitted a public comment, and a couple other organizations submitted a public comment. So this is just a good way of putting your voice out there, and we learned through the Lymphedema Treatment Act public comments that they are read and you do get change. Because my talk last year was before the public comment session for Lymphedema Treatment Act. So initially, CMS proposed 2 daytime garments per every 6 months. And after the public comment session and hearing from patients, they increased it to 3 sets. So they do listen, and again, patients, clinicians do have power in that. So there's my contact information, and I don't know, there were a couple questions I know on the app that I did respond to, and a couple other ones were kind of like, how can patients, advocate better? I know Jonathan mentioned using the resources that they have to give to your doctors and your therapist is probably the best. Someone asked if anyone's already talking to Medicare about anything. Not to my knowledge. There's a lot of one-on-one help going on, a lot of people helping others get, and that's great. My mind just goes, because I can do that. I've won external appeals for medical things. My thing is, let's fix it at the top so there's not so much fighting on the individual level. Let's try to make it a little bit easier for us.
Sarah, we do have a couple questions.
Okay.
As a patient, what ways would be most effective in getting the word out to doctors and therapists and other healthcare providers?
Yeah, like giving the documentation, the lipedema resource guide from the Lipedema Foundation they just put out. I think a lot of what I'm getting is I get contacted by doctors too, and they say, I just had a patient diagnosed, what can I help with? And I think one of the biggest struggles right now is really what's next. And I think as patients, we are advocating for ourselves and giving that information out and help spreading it as much as possible. I mean, if you go to a clinic that has several doctors, leave some in the waiting room, I think that would be a way. I think we're really doing the best we can on that, and we need to kind of take it to, once someone is diagnosed, how are they getting access to the treatment they need? Because it can be very frustrating to get diagnosed and be like, now what?
Thank you. Another question is how do we get involved legislatively like you are?
Well, the QR code, so those are a couple, and that organization, the Obesity Action Coalition, I serve on their board too. They have a lot of actions right now in some states. There's some actions in Tennessee to get these medications covered for Medicaid patients. And California and Colorado are some other states they're working on. So, and I think the other one, even though lipedema is not rare, but if you have Dercums or the other ones, if you are involved with Rare Disease Advocacy group, I think it's Rare Disease Legislative Advocates. They have a rare day on the Hill. And so they will take you and you can speak whatever bill or whatever action that you want. The other thing is we kind of need to figure out what needs to be fixed in order for us to get care. I know a question was about, like, does Medicare cover? Medicare covers surgery. If you actually go to medicare.gov and type in lipedema, cosmetic surgery is the first thing that pops up. But there's not an actual, like, coverage policy for it. And that would be like a local or national determination coverage policy. So we can look into what it takes to ask and get on the schedule for that. All the government agencies have like an annual schedule of when they take applications for things and when they do hearings for things and make decisions on things. So that would be something that we need to like look into and prepare and take the actual steps to do.
Well, thank you very much, Sarah.
Thank you.